So I'll just, it's not going to be a really long presentation, but I'm going to talk a little bit about the illness and the outbreak and a little bit about vaping, although I only gave you a really good information there. I'll just add to it a little bit and then tell you a little bit about what we're doing. So as Emily mentioned, the vaping devices were introduced to the market in 2007. Since then, there have been case reports of lung injuries and histories of vaping, and people have suspected that there was an association, but you can't prove an association with one case. As we say in epidemiology, association is not the same as causation, so you have to do a lot more work to be able to say that one thing causes another. And what you need is more cases, and now we have them. So now we have our outbreak. Hopefully this will help us prove an association and find out exactly what is causing these illnesses. So in July, there were some cases that were in one hospital about the same time, and the physicians noticed that there were these young people had illness that they shouldn't have had, and they all had histories of vaping, and also vaping similar kinds of things. And so they notified their state health departments, and Wisconsin and Illinois began an investigation and brought CDC on board very quickly. By August, the CDC had put out a national health alert message, and the Nebraska Department of Health and Human Services also sent that out to all healthcare providers in Nebraska, telling them about this outbreak and asking them to report cases to public health. And then the reports started coming in. So what we're talking about is a lung injury, and injury is distinguishing it from infection, because a lot of lung problems are caused by infections. This is not caused by an infection. As of last week, CDC has actually named it. So this is an official name of this. It's called e-cigarette or vaping product use lung injury or ELE. So this is a new thing. So the lung injury, basically, the function of your lung is to bring air in and take the oxygen out of the air and put it in your blood supply, and then take the carbon dioxide out of your blood and breathe it back out. And so a lung injury impairs your lungs' ability to do that, and then you get various symptoms, and your blood oxygen levels are lower than they should be. By definition, these cases have had a history of vaping, and their symptoms have been things that you would expect, like cough, chest pain, and shortness of breath. But also a lot of them have had gastrointestinal symptoms, vomiting, and diarrhea. And also this is really a diagnosis of exclusion. There's really no specific test or marker. You have to rule out infectious causes. And I'll just mention how we determine if something is a case or not. We've mentioned before how in public health we use a surveillance case definition, which is different than a diagnosis. So with the surveillance case definition, all health departments in the country are using the exact same criteria, and it's very specific. You have to have a serious lung injury. They have to have had chest x-rays or CAT scans of the lungs. They have to have ruled out various infections, certain kinds of tests that would rule out infections. And the clinicians feel that vaping explains the symptoms also. So that is what we're using as our definition, so that all the case counting nationwide is based on the same criteria. So as of October 8, the CDC has reported that 1,299 cases have been reported in the United States with 26 deaths. 11 of those cases have been in Nebraska, and 5 of them have been in Douglas County. We've had 1 death, and in addition to the 5, we had one more possible report that we're investigating that we don't know, so that may go up. The death that you mentioned was actually in the springtime. Basically, someone who was a friend of this person contacted the state health department and had heard about the vaping illnesses. And and said that his friend had died of lung disease in the spring, and he had seen him at a reunion or something, and he was vaping like every half hour. He was going out to vape, and just really high levels of vaping. And so he said, I just wanted to let you know about this. And so we looked into it and investigated the case, and indeed it did not meet the case definition for vaping-related illness. Nationally, the cases have been 70% male. Median age was 24, and it's a broad age range. A lot of them, less than 80% have been less than 35, and 15% have been less than 18. Of the deaths, the median age is 49, and the age range is 17 is the youngest death, up to 75. So among the 573 patients that have been interviewed so far, 76% have used THC products in their vaping. 32% of the cases exclusively use THC and not nicotine products. Then a lot of people used both. 58% used any nicotine products, and 13% of the cases exclusively used nicotine and denied any THC use. And this is our epi curve, which we always like to show. The blue lines are date of admission to a hospital, and the orange lines are the date of symptom onset. And so you can see this looks like a traditional outbreak where we've got our curve going up. Those first cases are in March. So we do think there is something different going on with this. The question was, is this new, or did we just not recognize it? That's still a question. We don't know what the extent of this was before this outbreak was identified. And then the little inset shows you all the states that have cases. So the findings so far, the investigation is nowhere near completed, but thus far, even with all those cases, they have not identified any single compound or ingredient that is suspected to be the cause. The type of injury is not fully understood. There are a couple different things that are happening, and it's not consistent with all the cases. A lot of them are showing something that looks like a chemical pneumonitis, which you may have heard has been described as popcorn lung. Popcorn lung is actually an occupational injury that showed us that the chemical diacetyl, which is a flavoring in butter flavoring for popcorn, causes bronchiolitis obliterans, which is a very good name because it causes basically obliteration of your very small tubes that lead to your alveoli. And as you know, butter is safe to eat. The thing is, with these popcorn workers, what they do when they make popcorn is they have these vats of dry popcorn flavoring, and they have to pour them into something else, and it makes for these big clouds of dust of this popcorn flavoring. So they're inhaling the diacetyl rather than eating it. And so that's how we found out the association between the diacetyl and the chemical pneumonitis or bronchiolitis obliterans. The other thing that some of the cases have been showing are evidence that some oils have been involved, and the reason that's also suspected is because you have to use oils to dissolve the THC into the vaping juice. So that's but not all the cases have had this. They do think that it may be related. At least some of it may be related to it, especially off the street kind of products that are just kind of made in someone's home or wherever. But they have stated very clearly that nicotine-only products have not been ruled out, and there may be more than one thing. There may be more than one thing that's causing this. So, just some information on what the vaping problem is. Emily talked about the risk. We have some data on high school kids who were asked, have you used an electronic vapor product? The National Youth Risk Behavioral Survey and the Douglas County Survey are shown here. The 45% of high school kids nationally have reported that they have ever used vaping. 24% say they currently use it, and 3% say they frequently use it. And then, so Douglas County also does this, but I have an asterisk by that because our sample size was not large enough to be able to generalize this to all public school students. This number reflects just those students who brought back a consent form from their parents and then were able to take the survey. So that might not reflect what all high school students would do. But so our numbers are lower, 32% for ever used it and 17% for currently vape. And just a little bit more about vaping products. When I was searching the web looking for good visuals on how to kind of describe these, it was kind of shocking because all the vaping websites had really great information on these products and lots of helpful videos and how to start vaping. I saw how to choose, how to decide what concentration of nicotine you want. It's really quite frightening. But basically, there are generations of products. The first products that they refer to as the first generation were just like the electronic cigarettes that look like a cigarette. They even called them ciga-likes because it looked like a cigarette, or minis. Many of them were disposable. Then the second generation, they started looking like pens, and they were refillable. And then more recently, there are even more kinds called mechanical modified nicotine delivery systems, so mods, and they even call them mods, carts for cartridges, tanks, and then of course you know about the Juuls. These are, you can add anything to these. Just to add on to a little bit about what Emily talked about, there's no oversight of the vaping industry. It's not regulated like a drug. There have been no safety studies, no approvals. They do have some say, like Emily mentioned, if a product is actually marketed as something that you can do to help you stop smoking, even though it's never been approved for that purpose, if they're marketing it that way, then it would be covered by the FDA's tobacco product regulations. And if it is marketed as a product to help smoking, then it is regulated like a drug. Most flavorings in e-liquids, there are hundreds of chemicals that are in these flavorings. Most of them that you buy off the shelf have chemicals that are designated as generally recognized as safe, which is an actual FDA term, GRAS, G-R-A-S, for things that people have been eating and consuming for years. There've never been any studies, but they're basically, people think that they're safe, things that you eat. And so that designation is included in these liquids, but as I mentioned, ingesting is much different than inhaling. There are also no standards on labeling. You don't know what's in it, and there's also no quality control oversight, so you don't know the amounts. Even if you get the same product, it might not have the same amount. And then I just mentioned the diacetyl, which is the butter flavoring, but that's a common flavoring in some of these liquids. A couple of the other things that are found in it, propylene glycol is what they use in rock concerts for the fog. Formaldehyde, acetaldehyde. Acetaldehyde also causes the bronchiolitis of obliterans. Heating the liquid will produce even more toxic chemicals, and these devices work by heating. And heating also increases the amount of nicotine in the fluid. So there are a lot of variables. This comes from a group in Colorado called Gas Before Air, an air quality group. But it's just a slightly bigger list. I'm sure there are more chemicals that have been found in vaping liquids. The chemicals in red, they have determined are emitted in secondhand smokes. There is some research going on into secondhand smoke right now, not a lot, but I
Of vaping products?
Yeah.
Okay.
Yep. Secondhand vape, I guess.
What keeps the smell, like, you know, when you smoke a cigarette, there's the smell, and I assume because it's burning versus being heated, but how is it not a smell to vaping?
I think it's just the constituent of the, or whatever's in the cigarette, the paper, the tar, those things smell different than the vaping products. With the vaping products, you can keep things that smell out of it. So, CDC's bottom line, what's the risk for kids for e-cigarettes? It's unsafe. They mostly contain nicotine. Nicotine's highly addictive, can harm adolescent brain development, and that brain development continues into their mid-20s. E-cigarettes can contain other harmful substances, and people who use e-cigarettes may be more likely to smoke cigarettes in the future. And the American Academy of Pediatrics is even more emphatic. Stop vaping now. Just that, I like that. They can say what they want to say. So the CDC's recommendations right now, based on the outbreak, are for all people to consider not using e-cigarettes or vaping products. We don't have enough evidence to say stop all vaping. Don't use products that contain THC. Don't buy them off the street. Don't modify or add any substances. Children and pregnant women should not use any vaping product because they're not safe. And if people are vaping to quit smoking, don't return to smoking. There are other evidence-based treatments that they can use to stop smoking. And then here's my last slide. So just a little bit about what DCHD is doing. I think Dr. Ford mentioned that we have formed a team. This is a different kind of outbreak. It's not an infectious disease outbreak, so it's different than the outbreaks we usually investigate. So it's basically we have team members like Emily, our tobacco control group, health promotion. Of course, epidemiology is focusing on reporting, and we've brought in our STD program because our STD investigators are highly trained in talking to people about sensitive topics. They're really good at that. So we're going to have them help investigate some of these cases to try to really find what they're using. Bill, of course, is on the team. And then our emergency response coordinators are going to help us kind of move and not go down rabbit holes. So we've been updating healthcare providers, investigating cases, and what we're doing now is trying to help you and inform you so that you can determine our response. So